We're going to be doing a complete adult assessment on my patient Sierra here. We're going to look at her general overall appearance. She has no signs of distress. She is able to sit upright. She's breathing fine. There's no deviations. Her skin is pink and it's warm to touch. There's no skin loss anywhere. She's alert and oriented. She knows where she is, the date, and the patient knows her name. She is 5'7" and weighs 160 pounds. We have done previous Snellen charts on her, and her vision is 70/20. She wears glasses when she's driving and things. She does not have them with her today.
I have my contacts in today.
Oh, okay. She has her contacts. That's even better. We took her vital signs just a second ago, and her blood pressure was 123/76. She's at 100% on room air. Her heart rate was 63. Her respirations were 16, and her temperature was 98.6. All right, we're looking at Sierra's head. It is in line. Her facial features are within normal limits, and they are symmetrical. Her skin is normal, has a normal skin tone, is pink throughout. There's no lesion swellings or abnormalities to it. Patient's hair is brunette, is thick, is well groomed. She doesn't have any hair loss. I'm going to look at her eyes and do Perla. Both sides do constrict. Her pupils are round and reactive to light, and one constricts when the other when light is shining in the other one. The patient is completely oriented and is aware of where she is. Her cognitive functions are within normal limits for her age and her gender. She is in a good mood. She doesn't have any thoughts of self-harm or anything. I'm going to look at the patient's ears. They are within normal limits for her age and gender. I'm going to look at her eardrum. It's gray. There is a little bit of earwax in there, which is normal. There's no foreign objects in there. There's no discharge or anything, though. I'm going to look at her nose. Nasolabial is where it needs to be. So I'm going to feel your nose. The cartilage is spongy and the bone is hard. There's no lesions, no swelling, no edema. Any pain?
No.
Okay. All right, we're going to look at the patient's mouth. Can you stick out your tongue and say, oh? The soft palate does fall and rise. Okay. The tongue is midline. The mouth is moist and pink like it should be, so everything is within normal limits for that. There's no swelling or lesions or anything. She can swallow, so she does have a gag reflex. Her neck she has full range of motion. Her musculature is within normal limits for her age and her sex. I'm going to palpate for any lymph nodes. I do not feel any. Check out her thyroid. Can't feel the trachea. Can you swallow for me? Thyroid is not palpable, which is good. We're going to look at her upper extremities. Can you adduct your arms for me, side to side, up and down? Yeah, good job. She has full range of motion. Her strength is within normal limits. It's bilaterally equal. Her pulses, I'm going to check her radial and brachial. Both good and strong. I'm going to check her epitrochlear nodes. Those are within normal limits for her age and her sex. Off camera, I did look at her back and her anterior chest and posterior chest. The skin is all normal and pink. Skin throughout. There's no lesions or swelling or any depressions. Her musculature is within normal limits. Her spine is aligned in midline, straight in midline. There's no pain when it is palpated. She can move her scapulus freely. She had no pain with that. There's no swelling around that. And when I palpated her CVA area, there's no tenderness. And when we checked her, when I inspected her front, there was also, the skin was within normal limits. It's pink throughout. No abnormalities or anything. There's no nodules felt. When I felt for her lymph nodes, there's none swollen. Her PMI is fifth intercostal space down to the left side of the sternal border. Alright, now I'm going to listen to Sierra's lungs. Sorry. I used to listen to your heart. Listen to your belly too. Alright, her lung fields are clear. There is no wheezes or rhonchi or and there's no crackles. She has she doesn't have any labored breathing. Her thoracic expansion is present. It's equal bilaterally, and so that is good. Her heart sound is, you can hear S1, S2. It is rate of 63, which is good. When we listened to her stomach, her bowel sounds were active, which is good. It's within normal limits. Alright, we're going to be looking at Sierra's jugular veins. You can see there's no distension on either side. They are equal. She has a three positive vein pulsation on each side, so that is within normal limits. Again, her heart sounded fine. S1, S2, no problems with that. Her abdomen, I did listen to it. Her bowel sounds were active. She has her skin tone is pink, throughout and matches the rest of her body. It's smooth. There's no tenderness or swelling or lesions. Now I looked at her feet and legs. Her skin is pink and smooth. There is no lesions or abrasions or swelling or edema in her legs. The hair, she shaves her legs, so there's no hair, which is normal for her age and sex. The muscles are fine. She can abduct and adduct them just fine. She has full range of motion. That goes along with her muscles are fine too, because she can move and walk around. Her pulses on her feet, her dorsal pedis pulses were 2+. That is within normal limits. When she's walking, I had her move her hips around too. There's no tenderness or swelling or depressions. She had full range of motion. My patient's musculoskeletal function is fine. She can move freely with no problems or no pain. Now we're going to check Sierra's neurological functions. I'm going to ask her to distinguish between sharp or dull sensations on her arms.
Dull. 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 Sharp.
Sharp. Okay, so she can tell the difference between those, so that is within normal limits. Now we're going to do the 2-point discrimination.
1, 2. 1, 2.
Okay, so that's within normal limits. She knows which is which there. Patient's fine motor coordinations are within normal limits. She has smooth movements. Can you do the finger test for me? Awesome. That is within normal limits. She's doing good. I'm going to have her follow my finger as she touches her nose, and then touch my finger as I move it throughout her visual field. Sorry. That is within normal limits as well. We did looked at all of her reflexes, and they were within normal limits. They're all 2+. which is what you want. And as we stated earlier, we looked at her spine, and it is smooth, it is midline, no swelling or depressions. It is straight, there's no curvature to it that indicates scoliosis or anything. She does have full range of motion with it. And as she walks, she has a steady gait. There's no balance problems. And this concludes my complete adult assessment.